Hi guys, welcome back to my YouTube channel. And today we will start with the first chapter of histology, that is epithelium. Before we start, just keep in mind the pink colored I use here is corresponding to the eosin pencil, and the purple color is corresponding to the hematoxylin pencil. Now the key learning objectives for today is the types of epithelium, their functions, and their examples, and obviously how to draw them. So now we come to the classification of epithelium. Epithelium is classified into simple, stratified, and specialized. Now simple is further classified into squamous, cuboidal, and columnar. Stratified is further classified into stratified squamous, stratified cuboidal, and stratified columnar. Now stratified squamous is also further divided into keratinized and non-keratinized forms. Now coming to specialized epithelium is of few types, that is transitional, stereocilia, microvilli, goblet cells, and pseudostratified. So the major chunk, which is from stereocilia to pseudostratified, they come under columnar as well. But I've kept them as a specialized classification because they are slightly different than the normal forms of epithelium. Anyways, moving on to simple squamous epithelium. So the basic features that we see here is that it is a single layered, because since it is simple, it will be a single layer of cells. They are flat cells with very less cytoplasm, and the nucleus is also slightly flattened and protruding from the cell. Then the functions of this thin layer of squamous epithelium is basically transport of substances and diffusion of gases. Since transport of substances and diffusion of gases, you can find them in alveoli, mesothelium, and endothelium. Now endothelium is the lining of the blood vessels. This is how it looks under the microscope. You can see a layer of flat cells with flat nuclei. And to draw it, first obviously draw a circle and draw a straight line. This will be the basement of the epithelium, basement membrane of the epithelium. And now after that you draw tiny little squamous cells. This is how you draw it, and you put a nucleus. Also do remember to color the cytoplasm lightly with the pencil, with the eosin pencil. Next we come to simple cuboidal epithelium. The features of this is that again it's a single layer of cuboidal cells. The height over here is equal to width. So a cube is something that has equal height, width and length. So your height and width will be equal for the cells. The nucleus will be round and centrally placed. Now the functions of this epithelium is secretion, absorption and excretion. Majorly it is secretion and excretion. So the major examples for this will be the follicles of thyroid that secretes the thyroid fluid, the thyroxine enzyme. The thyroxine hormone in the colloid. The ducts of the glands, germinal epithelium, PCT and DCT. This is where you will find it. So this is a thyroid gland ka example. You can see the cuboidal cells with huge round nuclei, and the pink part in the center is the colloid. This is how you draw it. Again, draw the basement membrane and draw the cuboidal cells. This is how you do it. And you make a centrally placed nucleus. Quickly coming on to simple columnar epithelium. They are single layer tall cells. Now since they are columnar, they will be tall, right? So the height of these cells will be greater than the width. The nucleus will be oval in shape and slightly closer to the base. The functions over here is absorption and secretion. Mainly absorption over here. So absorption kahan hota hai? It is there in the stomach and the small intestine. Okay. So here you can see the tall simple columnar epithelium. This is the lumen of the small intestine. Alright. Now this is how you draw it. Draw basement membrane and draw the columnar cells which are taller. with a oval nucleus closer to the base. Now we come to specialized columnar epithelium. We'll do the stratified part a little later. So in specialized columnar epithelium, I've put stereocilia, microvilli and goblet cells side by side for comparison. Alright. So stereocilia have the basic function of movement or propulsion of substances ताकि उसको आगे भेज सके. ठीक है. So the example over here is fallopian tube and vas deferens. In fallopian tube, you need to move the egg forward, okay, so that it does not remain in a single space of the fallopian tube. So that's why you have stereocilia over here. You can see it in this picture like this. These are the columnar cells and this is the stereocilia. This is a picture of the vas deferens, by the way, because in the vas deferens you need to move the sperms forward. You draw it by drawing a basement membrane and drawing the simple columnar epithelium, and then make lines, like tiny lines on top of the epithelium, and you'll make the stereocilia type. Coming to microvilli. Microvilli are they're smaller than the stereocilia and more in number. So whenever you see microvilli is in places where surface area has to be more. Alright, it increases the surface area. So where do you need surface area? For it in places where you need to absorb things, right? So this is found in small intestine. This is this microvilli of enterocytes, that is the small intestine cells. This is how it looks under low power. Again, here you need to draw basement membrane and then draw tiny lines like this. Coming to goblet cells, you need to you will find these in places where you need to secrete mucus, right? Like in large intestine majorly, because large intestine needs mucus for the food, the bolus or the feces form to move forward and not remain at one place. So the goblet cells, how will you draw it is you can draw beech mein some columnar cells, and then in places where you have not drawn the columnar cells, you need to make goblet like shapes. Alright, like this. This is a slide of the large intestine. You can see the goblet cells. You can see the tiny spaces, the white spaces, circular spaces are where goblet cells are. Coming to pseudostratified columnar epithelium. So here you can see, you feel that there are two layers of epithelium, but it is actually only a single layer. The cells over here differ in height, but they remain on the same basement membrane. Alright. So as you can see, this is the same basement membrane, but here you can see a tall cell and a shorter cell, but they are on the same basement membrane. This is found in trachea, bronchus and duct of epididymis. This is a slide of trachea. You can see multiple nucleus over here. You feel that they are stratified, but they are not. They are pseudostratified. Coming on to stratified epithelium. Apologies, before that we'll do transitional epithelium. I made a mistake over here, but forgetting that. Transitional epithelium is the next sub-classification. These have umbrella-like cells with round nucleus and they're very stretchable. This is also, you can say that this is a type of stratified epithelium, right? Because there are multiple cellular layers, alright? At the base you have the columnar cells. On top of that you have polygonal cells. They are randomly polygonal shaped cells which are placed, multiple layers. And on top of that, the topmost layer are umbrella-like cells with a very round nucleus centrally placed. So this is different from the squamous epithelium because there the cytoplasm is very less. But in umbrella-like cells, you can see a great chunk of cytoplasm which is visible. And you can find them as two types, relaxed and stretched. Alright, they help in cementing the organs so that the liquid or fluid does not flow out. So this is found mainly in ureter and urinary bladder. This is a slide of the urinary bladder. Sorry, the ureter. My bad. You can see the umbrella cells over here very clearly. You can see the columnar cells at the bottom and random shaped cells in the middle, right here. Yep. So how you draw is columnar cells, random shaped cells on top, and then the umbrella cells. Alright. Coming to stratified squamous non-keratinized epithelium. So the base of this is columnar cells. In the middle, you have the polyhedral cells, and on the top you have the squamous cells. This is majorly found in the oral cavity, or majorly in mouth, pharynx, esophagus. Alright. This is a slide of, I think, the esophagus. So you can see the flat cells on the top and columnar cells at the bottom and random shaped cells in the middle. Coming to stratified squamous keratinized epithelium, the base is columnar, the middle part is polyhedral, on top of that you have the squamous cells. So till now it is the same as stratified squamous non-keratinized epithelium, but an additional layer of keratin is at the top. It's the topmost layer. This is found in skin. So keratin are a layer of dead cells. Okay, so that is why you see no nucleus we have drawn over here. This is a slide of the skin. You can see a thick layer of keratin over here. If I zoom in a little, you can see squamous cells, and below that you can see polyhedral cells, and below that you can see columnar cells. Yes. So coming to stratified, so the next two cells which are there, they are not that important, the layers, but because like you barely find them anywhere, but we'll still discuss about it. That is the stratified cuboidal epithelium. You will see cuboidal cells, multiple layers. They are found in sweat glands and ovarian follicles. So wherever you have a lot of secretion. And why in ovarian follicles? Because these are the primordial growth cells which then develop and form circular cells later in life. Then you have stratified columnar epithelium, multiple layers of columnar cells. They are found in anal canals and large ducts. Alright, majorly for absorption, and stratified cuboidal is majorly for secretion. Now doing a small quick revision of what we did right now. We first classified epithelium into simple, stratified and specialized. We saw in simple squamous epithelium, whose function is rapid transport of substances and diffusion of gases because of its thin layer. Then in simple cuboidal, we saw that it is majorly for secretion, excretion and then absorption. In simple columnar, we saw it's majorly for absorption and secretion. Then in specialized columnar epithelium, we saw stereocilia, microvilli, goblet cells and pseudostratified columnar epithelium. In stereocilia, the function is majorly the movement or propulsion of substances. In microvilli, it is increased surface area, and in goblet cells, you have mucus secretion. In pseudostratified columnar epithelium, there are cells of different heights but all remain on the same basement membrane. Then coming to transitional epithelium is found in organs where there is requirement of cementing so that there is no leakage of liquid. In stratified squamous epithelium, we have stratified squamous non-keratinized, which is found in mouth, pharynx, esophagus, and stratified squamous keratinized, which is found majorly only on the skin. Then we have the stratified cuboidal epithelium, which is found in sweat glands, ovarian follicles, and stratified columnar epithelium, which is found in anal canals and large ducts. So that is it for today, guys. Thank you for watching my video. Like, share and do subscribe to my channel. See you in the next one. Bye bye.